topic of this track, talking a bit about what is happening in Europe, or what is happening in policies and regulations in Europe. And just to remind you, well, I'm sure you know what I will talk about, but just to remind a bit the steps we took in Europe since a few years ago. I will remove that, yeah, better. Since a few years ago to work on this topic of data management, data governance, data regulation, and just to have that in mind when we come to the real life and the real discussion around Catalonia project. So just to remind a few ideas around data, because sometimes we talk about data with some people think it's synonym of information or knowledge or insight. So I wanted just to, I like this diagram, well, not the last one, of course, conspiracy theory, we are all sick of that during the year, but the relation between the data and the information, the knowledge we can extract, the insight we can extract, and the wisdom we are achieving at the end. So it was important. Just to give an example, when we have a traffic light, the raw data we have about that is the thing in orange. So something that nobody understands, of course. So we have to add meaning, to add context, and to apply it if we really want to extract something, a valuable thing from the data. I think it was important to remind that. So what I just said was obvious perhaps for data scientists, certainly obvious for data scientists and engineers. What I will say here perhaps is obvious for clinical people and people in healthcare, but some of you are not familiar with healthcare, but what is the relation between data and what are the challenges around data is the ability to collect data from a variety of sources and environments, which is huge. When we look at what are the determinants of the health of a person, we need to pay attention on different factors that are playing a role in the health of somebody. So the genetic factor, the where you live, the behaviors you have, the lifestyle you have, the choice you are making, and the access you have to healthcare system. And if we look at all these determinants, if we look at where I can collect the data for all these determinants, you can achieve a long list of organizations, of tools, of sensors, of wearables, of smartphone. Well, you can go on many aspects. And all these aspects are at different weight in the role they play in health, but they are as well important. And there are some aspects we can change, other we can difficultly change, at least in human, like the genetics, for instance. Why data are so important nowadays as well, for different reasons, and I will let my colleagues from Catalonia to explain why. But one of the major trends this last year is the personalized health. I use personalized health instead of personalized medicine, because I think health is a bit more than only medicine. But what I call the P-health, it's because you have different trends, the people, speakers, researchers speaking about these P things, but it's personalized, it's preventive, it's predictive, it's participatory, it's populational health. We can build platform, we can have proven health. What I mean is that in all these P health data or health-related data are very important to build the models. And the other trend I wanted to underline, and again, it's not an exhaustive list of reasons why data is important, but the digital twins, as we are doing since years, digital twins for manufacturing or cities, using the data we extract from machine to create virtual models of this machine or of these cities. We are nowadays working on virtual models of humans. We have here in Catalonia with the work of the supercomputer, for instance, some work around these human digital twins, and it's pretty advanced. The data economy is growing. Obvious statement in Mobile World Congress, obviously, but I think it was important to underline that. More and more data are produced. The money and the business developed around this data is increasing as well. And I have to say, most of this money is developed, or most of this business is developed by the private sector. the public sector is nowadays playing not a large role in that, and this is one of the objectives we will see that Europe is building. We had 3 years ago this front page of The Economist comparing oil and data. Personally, I'm not a big fan of this comparison because I think there are many differences between oil and data, but it was just to underline the fact that we have big players, private players in this case, playing on this world of data. And this is one of the things, this situation with this large company that made Europe thinking about what kind of regulation, what kind of policies we can develop in Europe to create a good framework ensuring the benefits for the citizens in Europe. Yesterday I was talking with some of you just earlier, I heard about Mr. Harari's vision of the future. Actually yesterday the message were pretty dark and pretty pessimistic about the future, but somewhere realistic as well. Harari is a famous visionary and a good analyst of what happened in the last years. And actually the fact that the data are concentrated in a few entities, whether they are private or public actually, is a problem for the humanity and the humankind. He's even proposing that different spaces we will develop upon that. So one of the challenges is how we control and back control these entities holding the data or collecting the data. This is one of the topics. So in Europe we have created in 2018, or actually it entered in force in 2018, new rights for the citizens in order to protect them with a GDPR law regulation. So you have here the rights we have firmly put in this law, in this regulation. And we were asking to the European citizens if they were keen to share their data even with this protection, because this survey was from 2020. And we see that half of the people, so half of the room, would be keen to share the data. But when we ask them with who you want to share, most of the people are saying, okay for medical research, okay for research in general, okay with an hospital, but not okay with a private company. So that was the point of view of Europeans in this large survey. But actually, how many click yes when Facebook, Instagram, TikTok or Google are asking? I think all of them. So there is still a difference between the theory and the practice and the reality. And so in 2020, last year, we had a kind of acceleration of European regulation and European policies on this subject. And we had 3 big texts proposed by the European Commission. So you see, this couple will last a few years, yet still Mrs. Verstager and Mr. Breton, the 2 commissioners in charge of these questions, with the European Data Strategy first, then the European Data Governance Act, and then the 2 acts, Digital Services Market and Digital Services Act and Digital Market Act, which were different texts that you can find on internet easily, that try to create this good framework with ethical aspects around data management. And we had the creation of this concept in the EU data strategy of the European data space. The purpose was to be able to share across the border within the European continent, to share some data across different sectors. So we had these 9 sectors, healthcare is one of them, and this story of data spaces in Europe has started and be declined in different sectors. And for the health, we have here what is the plan at the moment, and this year is a launch, it's a huge priority for the new launch of the new program period of Europe. Some different actions are launched. You can see here the objectives. The objective is to make available the data across the border for care first, for policy making and for research and innovation. These are the 3 objectives, and how we can do that, what kind of infrastructure, what kind of capacities, what kind of standards we should use, etc., are the main questions that we, collectively in Europe, we have to solve. And a joint action has been developed between 25 of the 27 member states in Europe, called TEDAS, Toward a European Health Data Space. You can see on the website they have different activities, and you can get involved in that if you're interested to think about what looks like a European health data space. We had some work as well in the Digital Health Society group. It's one of the spin-off of ECHAlliance this last year, and had some recommendation last year in 2020 about this health data ecosystem, and some of you in the room participated to this collective work of recommendation toward the European Commission and the different governments to do so.